Hi guys, this is Dr. Brian out from Out Family Chiropractic. Just coming to you from St. Francis, Minnesota here. In today's seminar, we're going to talk about improving your performance in the gym and in all the activities that we do. I really like to consider our life an activity that we're constantly doing. So when we have these things going on in our lives, like the gym, yard work, all those types of things, we really want to emphasize two main things. One is improve our performance to be able to do that in the long term, and then to prevent really any injury that might come about. Okay, so we're going to talk specifically about those two things. And like I said, people are always training, no matter what you're doing. You get up, you walk, you go to work, you do the yard work. Some people go to the gym, they run. So whatever activity that it is, life is so busy that we have to really think about it as just being like the gym for our life. So some people are still continuing to do things on the field. Right now, not so much, but going forward, when things start being able to open up again and we're able to get back onto the soccer field, the football field, whatever activity, the basketball court, all those types of things, we want to be really mindful about our performance and how we can enhance that, right? So you have no real change to feel the pain of a tissue injury. So you really have no chance to feel the pain of a tissue injury. So movement and pain are the same pathway. So that's why you hear it often said that athletes can play through pain. Sometimes you even see nowadays on the sidelines they'll have a bike. So if like a running back might have a lower body injury where they're tightening up, so they'll go put them on the bike and they'll continue to keep them moving so that they don't tighten up and so they can perform for the game. So it is also important to remember the body keeps a perfect score card of every trauma it endures during one's lifetime. So all those injuries start to build up, especially if we don't address them. So that we always recommend if somebody gets hurt, come in right away. We want to specifically try to avoid taking things like ibuprofen and Tylenol because that really slows down healing, and we'll talk about that more later. So when it comes to everything, movement patterns, movement never lies. So we want to look at posture and pain. So when somebody's in a specific posture, is it neutral spine? Are their shoulders slumping forward? Is their head pulled forward? Yeah, most people have heard now text neck. That's a huge thing where people are looking down and it creates a whole bunch of force. Some people equate it to about a 60-pound dumbbell hanging from your chin is when you look down and you text somebody, you look down at your phone watching a video. So that's a big thing. So we look at posture and pain. Overhead squat, we do that in the clinic. So we have a 3D camera called the KinetiSense. We take an overhead squat picture of you and we watch, and it analyzes your movement patterns. We also like to watch it as well because sometimes the camera doesn't always pick things up, but we can really see in real time how your body is moving. A hip hinge, right? This is a deadlift. We teach this often, keeping your spine in neutral so that when you go and bend over to pick something up, you don't take yourself out of neutral spine and cause an injury. Push-up. A lot of people can't even do a push-up because their core is so weak. Trunk stability push-up. So we challenge people to be able to push up through their shoulders and keep that trunk stable. We have them jump off a box. So this is what's called a valgus jump test. So they jump off a 12-inch box, watch how they land, don't coach them at all, and we see what their knees are doing. And then we have an upper and lower muscle firing pattern. So once again, this is some of that issues, like if somebody has a shoulder issue, is it weak in their lats? Is it weak in a biceps tendon? If it's lower body, often hip flexors are overactive and they start to become actually weak because they're firing all the time, and that shuts off the glutes on the backside. So we have a what's called a upper or lower cross syndrome issue. So let's move into principles of performance nutrition because that's really what we're trying to talk about. So first off, we want to maximize fuel. So what does this mean? Well, your energy is derived from mitochondria. This is something in your cell that starts to give you what's called ATP or create ATP, and that's the energy of the body. So you really want to start to support that mitochondrial function. Next, we want to minimize damage. Yep. Trauma, inflammation, oxidative stress, which is huge right now, and anything that's going to really restrict your body's ability to produce growth hormone. A lot of the athletes, when they were the baseball athletes, they were using growth hormone to recover faster, they could play longer, more years, because that helps them heal and recover faster from their day-to-day activities. Next, we want to optimize recovery. So this is all about when you should take nutrients, the delivery system, and the timing of it all. And lastly, sleep. So sleep is a huge thing right now. There's a lot of stress going on in the world, and so sleep is becoming less and less in a lot of people. So we want to start prioritizing sleep. Next, advanced nutritional topics that we're going to go into. Detoxification, super important right now. A lot of people probably aren't eating the best. The gyms are closed. Your choices of foods are starting to become limited as well too. Estrogen detoxification. Men and women. We're going to talk about low testosterone in men in the next couple months. So estrogen detox, using an anti-inflammatory diet, making sure what you're eating is going to really create an anti-inflammation environment within your body. Alkalizing your system where it needs to be alkalized. There are some parts of your body that needs to be acidified, so like your stomach and the first part of your digestive tract. Energy enhancement, we talked about that with the supporting mitochondrial function, and then really supporting that connective tissue, because when you're working out, that's really what you need to balance out, is being able to give the nutrients so that those soft tissues are going to be able to recover from whatever injury or whatever athletic performance that you're really trying to do, or whatever yard work you might be doing. Okay, so let's talk about injury. There's really 3 phases of injury. In the first 72 hours, what do we really want to address? Well, pain. A lot of people come in due to pain. So we want to manage pain. We want to resolve and minimize as much inflammation that's really creating that pain sensation. After that, we want to do is relax a lot of those muscles, right? So your body's natural reaction to protect yourself is create a brace. So muscle spasm, muscle tightening, stiffness, because it wants you to stop moving that body part because it was injured. A lot of people will try to work through that, and often that will create even more damage. And then next, we want to restore motion. So this is where chiropractic comes in, right? We do a lot of muscle work. We do some things called Graston technique here. We do a lot of stretching. We make sure that when you're doing an exercise at home, that it's done correctly. Getting the joint moving helps relieve a lot of that pain, inflammation, and muscle spasm. So getting that done is really, really important. We get massage in there as well, and that's super important as well. So that's phase 1, first 72 hours. So we want to address that. That's usually when people go and reach for that bottle of ibuprofen, Tylenol, naproxen, whatever they're going to do, right? Ice, heat, any of that stuff. But we want to really be mitigating a lot of that stuff with other things that aren't going to stop the healing process, because that inflammatory process is part healing as well. So if you just turn off the faucet, you're gonna delay healing. It's going to prolong the issue and actually make it so that you will have a more likely of a chance to be re-injured. Okay, so phase 2 is day 4 through 8 weeks of care, or 8 weeks of the process of the tissue being repaired. So yep, number 1, tissue repair has begun. Number 2, inflammation and pain is usually still there. Most people don't come in the first 72 hours if they injure themselves. Usually we get them a week to 2 weeks after, so they're already into phase 2. So we really have to be mindful of what they're doing. And then there's reduced motion, right? They can't walk, they can't get out of the chair, they can't run on the soccer field, they can't do a bunch of different things, and that's what drives them in, because their dissatisfaction with whatever activity they want to do and they can't, that drives them in because they want to get back to that as quickly as possible. And then phase 3, that's that kind of ongoing care, that wellness care that we like to have our patients continue to do to help with keeping them healthy, keeping the tissues moving and the joints moving properly, so that you can actually then improve your performance. Every NFL team, many of the baseball teams, they all have, a lot of the sports teams just in general have a team chiropractor on staff as part of their overall health wellness team to keep those athletes continuing to play and perform at a high level. So what are some things that we like to use in phase 1 of treatment? So that's that first 72 hours, that's that pain and inflammation. So the anti-inflammatory aids that we like to use in our office, number 1 is something called PRM Resolve. So think of this as when you take a fish oil, the EPA portion of fish oil has to go through a bunch of different processes, and it gets down to what these things are called resolvins. And about 40% of the population, they've estimated, can't make these resolvins. What do these resolvins do? Well, they resolve inflammation. So 40% of the population can't make these resolvins. So that means the inflammation is kind of just slowly burning there. Whereas, like I said before, if you take like ibuprofen, that's just going to stop the spigot from going anymore. So you just turn off the faucet, it turns back on when that wears off, turn it back on, turn it back off. So you're kind of doing this revolving door thing. Well, this is just going to slowly resolve that inflammation while allowing the body to still continue to heal up what it needs to do. Fish oil, always still a great thing. So that we talked about the EPA portion of the anti-inflammatory. Turmeric, I consider that just as good as ibuprofen. Many studies back that up. Boswellia is another good one, and ginger. So these are all good things that we can use to help with that anti-inflammatory aids. Next, we want to relax those muscles. I mean, when we got pain and inflammation, usually there's some muscle tightness, muscle spasm. Magnesium, it's my go-to, right? So calcium, in the simplest form, calcium causes a contraction of the muscle, and then magnesium causes the relaxation. So that's where your muscle cramping often occurs at night. You stop moving, the muscle cramps happen. So I know that you're deficient in magnesium. Calcium, you can use that as well. So a lot of the times we use calcium and magnesium together. I like to use something called L-theanine because there's always some amount of stress when we're dealing with muscle tension and muscle tightness right now. So L-theanine is really good. B6 and taurine, those are two really good things because they go to a neurotransmitter called GABA, and GABA is our calming mechanism, so that helps calm our minds down. And then valerian root is another really good one that helps really reduce some of that muscle tension as well. A lot of this stuff occurs due to the stress that you're feeling over the injury. So if we can work on that as well, along with the actual muscle contraction, that works really, really well with a lot of people. And you can't get that out of an ibuprofen. Okay, so that's phase one, really reducing the inflammation and relaxing the muscles. Phase two, this is where we start to get into the treatment, right? So we start remodeling tissue. We can do some exercise, some stretching, getting movement patterns restored. So tissue remodeling. This is what's called an extracellular matrix. So it's outside, so that's your tendons, ligaments, cartilage, and fascia. So these are all those things that we really want to be mindful about and getting those things healed up. So we want to reduce what I call the Pac-Man effect. So this is where enzymes go in there, and they're supposed to be eating up the inflammation. They actually start eating up the tissues. A lot of post-surgical injuries occur due to these inflammatory Pac-Mans going in there and eating up the tissue. So specifically things like an ACL injury. They didn't ever address the inflammatory portion of it, other than telling you to take ibuprofen. The other ones would be like rotator cuff. Rotator cuffs get redone all the time, and that's usually due to the fact that the surgery was a success. They did all the therapy right, but then a tear occurred again. That's because the Pac-Man was going there eating the tissue, and you get that re-tearing there. So they never really address that. So the patients that follow the things that we do tell them to do, they recover much faster, and their therapist is super excited for the progress that they make. So we want to reduce that. So we like to use something called EC Matrix, and that's a really great product that we have patients use to do that, to reduce that Pac-Man effect. Next, using collagen, right? Collagen is the backbone of all tissues. So if we can use some extra collagen and some extra protein, those two things, it's stated in the literature that when you get an injury, you need about 2 times the amount of protein than you normally would to heal up an injury. A lot of people just aren't going to be able to eat all that. So using some collagen, some high quality protein is super important to help supplement along and get those patients to heal faster and better. And then lastly, joint health. Usually if there's a muscle tendon issue, there's also a joint injury as well. So glucosamine chondroitin sulfate, long history. A lot of people use it for arthritis pain, but using it even for post-surgical or injury healing is super important. And we like to use Joint Ease, which is another anti-inflammatory to the joints to help with that healing process. Because if you keep that inflammation in the tissues and in the joints, that's where you're going to start to see that breakdown and that degeneration and the re-injury, and then the complaints about it hurts all the time. Okay, so phase 3 treatment and support, we want to continue with that connective tissue remodeling. So what are some of the things that we like to use? We like to use collagen and vitamin C. Vitamin C is the backbone of collagen, so we really like to use that. Continuing to use EPA and DHA. Fish oil, long history of overall benefit of anti-inflammatory. The DHA is great for your brain, so we use it on patients that get concussions, that have any kind of brain issues. Great for neurological issues like dementia, Alzheimer's, Parkinson's, all that type of stuff is really good for that. A multivitamin, multi-mineral. Look, most of our diets aren't up to par where they should be, right? So we're lacking in a lot of the nutrients, and a really good multivitamin is essential pretty much in anybody's cabinet right now. So using those types of things to really fill the gaps that aren't being met in our overall diets. Magnesium, so there's the muscle spasm. It's also involved in 300 different enzyme reactions, which is really important for your overall health. A probiotic, studies done on long distance endurance runners show that if they take a probiotic, they have less days sick and less days missed of training availability. So I think it was cut down by 50%. So the people that ran endurance runners would lose 48 days out of the year, where when they took a probiotic, they lost only about 24. So you with all that we know about the microbiome, so the gut environment, is that 70% of our immune system is there. So if we stress our bodies, then that microbiome is going to be stressed as well. So we want to be kind to that and feed those bugs as much as we can. So, and then lastly, vitamin D. Super important. We're in a northern environment, so vitamin D deficiency is very, very prevalent in our society. So getting your vitamin D levels up for optimal performance. Vitamin D is linked to 3,000 different reactions in your body out of 30,000. So it's a pretty important, some people don't even call it a vitamin. It's a pretty important hormone, basically, is what they say. Next, performance and recovery. So let's talk about the two different types of athletes. We're going to address the endurance athlete first, right? So these are those runners, those long distance people, bikers, all those types of things. So what is the number one goal? Adequate fuel. So they gotta really fuel their body to be able to perform for a long period of time. Next, we need to replenish the glycogen stores, so the sugar stores, and reduce any fatigue that they have, so they can go longer at the same rate of speed. Next, any building and repair of tissues. They're constantly just breaking down tissues over and over again, and maintain their immune system. That's the biggest thing probably in all of this, because if your immune system starts to react against you, that's where we're going to really have increased inflammation, breakdown of more tissue. You're not going to be able to replenish any kind of your stores that you need for energy, because you're going to produce too many oxidants at that point in time. So let's talk about your intake of actual food. So we're going to talk in what we call macronutrients, so carbs, protein, and fats. So the average endurance athlete, they're going to need for carb intake is going to be about 7 to 10 grams per kilogram of body weight for the first 1 to 3 hours of exercise. So if you're under an hour of exercise, this isn't usually going to be an endurance exercise aspect. So if you're going to the gym, you're lifting for an hour, you don't really need to follow this part. But as we get over an hour, we start to lose the body's energy stores. So, and most endurance athletes are going to go over an hour, right? They're going to go anywhere from 1 to 3 hours of running, biking, even more than that for if somebody's training for a marathon. So you want to get to that 7 to 10 grams. Protein, anywhere from 0.8 to about a gram per kilogram of body weight. Fats, we need 1 to 1.2 grams per kilogram of body weight as well. Because we really need to replenish those fluids and replace those fluids anything over that hour mark of exercise. So that's going to be super important. Okay, so think hard, hot, hour long. That's what we want to do, carbs and electrolytes. So a carb load, a lot of people talk about this, would be 3 hours prior to any exercise, and that's 1 to 1.2 grams per kilograms. And then getting those carbs post-workout, we want something that has carbs, protein, and electrolytes all together in a drink as much as we possibly can. So anything over an hour, you got to replenish carbs, got to get some protein because protein is the building block and those electrolytes that you've lost through sweat. And carbs will help that protein synthesis. So that's why you want to get a combination of the two. Next, performance and recovery. So let's talk about the strength athlete. So strength athlete, their main goal is maintain lean body mass. Right now, that should be a lot of us, in my mind. Proper amount of timing of carbs, protein, and fats, and improve our recovery after our workouts. So that post soreness that a lot of people get from working out, you change your workout up, you get sore again. You haven't worked out for a couple of weeks, and you go back to the gym, you get sore. It's hard to get off the toilet. That type of stuff after squats. So that's all about recovery. So the macros. So we want to talk about protein. So for a strength athlete, the building block really is protein. So they're going to have a higher amount of protein, and that's 1.2 to 2.0 grams per kilogram of body weight. And this should really be about 20 to 35% of calories should come from fat. So those are really your macros. The rest then would come from carbs. With a strength athlete, the carbs are going to be about timing. We'll talk about that. So the case for strength, why strength building is so important. It balances your hormones. It helps you age better. It helps you keep you lean, and it's really good for your brain. So there's been a lot of studies recently done on how exercise affects the brain, and strength building is a huge portion of that. So factors that enhance recovery. So let's talk about nutritional things that'll help. 3 things that will enhance recovery. Number 1, muscle regeneration. Number 2, reduce the fatigue. So a lot of people struggle with finishing a workout a lot of times. And number 3, support the immune health once again. So we're always going to be supporting that immune health, supporting that gut health. So it's always important. And then next, the last thing is always rest and sleep. When we talk about strength building in endurance athletes, sleep hygiene is always going to be number 1, no matter what. Your testosterone and your growth hormone will be highest when you sleep and highest when you work out. Okay. So after that, we really want to be mindful about how we're going to recover, how we can keep those growth hormone and testosterone levels increase as much as we can throughout life. A natural decline of testosterone, we'll talk about that in one of our other seminars, is not what they tell you it is. So that's just a little tidbit on that one. So what are some of the strength 8 nutrients, elite 8 nutrients for strength builders? Number 1, creatine. Tons of research done on creatine. It's what I consider a rate limiting step when we're talking about strength building. So it's really what your body uses in that first 10 to 15 seconds of an exercise or like a sprint, right? So if you're a basketball player and you're sprinting down the court, creatine is what's going to be used up. The average person should get about 5 grams per day. And some people, even if you're not working out heavy and hard, often people will use creatine throughout the day, and it's also really good for your brain. So some people will even told us to have patients use 2 grams per day of creatine helpful for things like ADD, ADHD, fatigue, focus, all that type of stuff. So that's really, really good for that. Glutamine, it's the most abundant amino acid in your body. We use it a lot for gut health. It helps to reestablish the gut lining, but it's really great for muscle repair as well. Also shown to help with blood sugar control. Really, when you're starting to build muscle, you're going to decrease your fat stores, and you're going to be able to control that blood sugar much better, decrease inflammation post-workout, so you're getting a good mixture of those carbs, proteins, and glutamine is super important in that as well. Branched chain amino acid, you get less post-exercise soreness and an increase in fat burning. You can if you use higher amounts of branched chain amino acids and glutamine together, it has been shown to be able to drop weight and increase muscle mass just by doing that alone. And taking some vitamin D as well has been shown to actually reduce fat stores as well. Omega-3s, so EPA and DHA, the anti-inflammatory portion, so if you reduce inflammation, that will help with your metabolic rate. The DHA, once again, brain food. A healthy brain usually leads to a healthy body as well. It's a good fat, and good fats will help you reduce your bad fats, especially around the abdominal area where that's the most dangerous fat out there. Curcumin or turmeric, that's anti-inflammatory. We talked about the SPMs as well too. Those are those resolvins that we talked about to help resolve that inflammation that occurs after your workout. So when you work out, you're really just tearing the tissue down, right? So that your body can then, you can eat, supply the nutrients it needs to rebuild so it can be stronger. So when we think about that, we don't want to just be thinking like, oh, I'm getting stronger in the gym. Actually, we're doing the opposite in the gym. It's when you're recovering and building that tissue back up is when that strength actually comes in. Probiotics, improve digestion of nutrients, because that's what our bugs are doing. They're eating the food that we supply them with, and then they actually give us the nutrients out there. It supports that immune system, so less days missed due to sickness, which is always good. So taking a probiotic, and I really, when we're talking about probiotics, and I've done many other short videos on this, is diversity is key. When we have diversity of the gut, that's a healthy gut. When we're feeding the same thing over and over again, that becomes a problem, and you can actually get an overabundance of even good bacteria. And if that good bacteria is deposited in the wrong place, now we have ourselves an even bigger issue called small intestinal bacterial overgrowth, which some people estimate as high as 60 to 70% of the population have some sort of small intestinal bacterial overgrowth, just in general. Next, L-arginine. So this is a great opening of blood vessels. So people with like high blood pressure, really good to take some L-arginine, because that, with the high blood pressure issues, your blood vessels are inflamed and constricting. So if we can open them up, that helps with that. And if you can improve blood flow to tissues, that supplies nutrients faster. They recover much better. It's been shown to improve athletic performance, and it has influences on mitochondrial function. So the energy production, by having you have more mitochondria means more energy, which means more health. So L-arginine is a super important one. It improves recovery by also increasing growth hormone, always really good. And you should really want to take this post-exercise. Some people with creatine as well, you want to take that post-exercise. A lot of people in the beginning were taking it before the exercise, but it's really good. It's been actually shown to be better to be taking post-exercise. CoQ10, this is an energy molecule. If you're on a statin drug, you definitely better be taking CoQ10. It helps with energy of the cell. It decreases muscle damage during exercise, and it also reduces inflammation. If you're looking specifically for fat loss, L-carnitine, super important. It actually helps release some of that fat within a cell so that you can burn it. Conjugated linoleic acid, alpha-lipoic acid, fish oil like we talked about, vitamin D with K2. Make sure if you are taking a vitamin D, you better be taking it with K2 as well. And vitamin A, those are all super important. The vitamin D and vitamin A is kind of funny, right? Fat-soluble vitamins, and you're trying to burn more fat. So a lot of times your body's storing fat so that it can try to increase the vitamin D level and the vitamin A level. So what are some things that we do in the office that are really helpful for patients to understand what their body is doing? We have something called an in-body bioimpedance analysis machine. So you stand on it, you grab a couple of handles, and it gives us a great tool of a person's overall health. So number one is we get what's called a phase angle. So the current that's being pushed through your body from the hands down through the feet, it bounces the signal off the cell. And that angle that it comes off the cell really tells us the integrity of the cell membrane. If the cell membrane is weak and it's not healthy, the angle is going to be much lower. As the cell membrane gets much more healthy, then that angle starts to increase. So we want to see it being above 7 if all possible. When we start getting lower, that's when chronic illness starts to happen. And if it gets too low, then that's really worse. Things like cancer really start to develop, because that's the health of the cell is really the health of the cell membrane. That's where all the action really happens. We can test also intracellular water, so water within the cell. If the cell is healthy, there will be more water within the cell. Nutrients are going into it then. We can then balance it out with extracellular water, so that's water outside the cell. If you're bloated, you're swollen, you're run down, that's all the garbage outside that should have been taken away. If you have an imbalance between intracellular and extracellular water, that means that you're usually full of toxins. That's just a soupy mess on that outside is how I like to describe it with patients. We get your fat mass, so that's a really good thing, and it actually tells us where your fat mass is conjugated there. It'll give us all your arms and so both arms and both legs, and then the trunk. So we can see how much muscle you have there, how much fat mass is there, so we can really start to make some decisions on your overall health. And then lean body mass. Lean body mass really should be a vital sign. It should probably be the number one vital sign. Because if you have low lean body mass, that's going to lead to your higher blood pressure typically. It's going to lead to all your chronic illnesses. It's going to lead to low oxygen availability, all those types of things. So I really think in our office we take it very seriously if somebody has low lean body mass. It goes to your longevity and quality of life overall. Many studies show that even just your leg mass, the amount of leg mass that you have, goes towards your quality of life and your longevity of life. And why does that correlate? Well, if you can't get out of a chair, you can't go for a walk, you can't go visit people, that really starts to reduce your body's ability to function just in general. So then you lose your community, you lose your body's ability to just move around throughout your day. Hard to get food, right? So in the old days, if you couldn't go get food, you were pretty much out of luck. So being fit is more for your quality of life and your longevity of life, and it starts in your legs. Glucose likes to go there first. So when we're working out, that's why I'd never skip leg day if you possibly can. I just don't do it. Please do leg day. Doing all these types of workouts are super important. So when it comes to performance, your goals are the key to your success. So really setting those goals, using things that we can use here in the office, like the KinetiSense, where we can see how you're moving, using the nutrients that we can supply your body with, and then really tracking your progress with that in-body machine. Those are really good tools that we can then use to make decisions on your overall health and where you want to take your health going forward. So if you guys have any questions, please share this video. A lot of the nutrients we went over, we can talk more about. If you have questions, reach out to me, share this video. We really like to answer any questions that you guys have. All right, be safe. Let's improve performance when the gyms all open up, and get outside, get some vitamin D. All right, thanks guys.